When I came here, I was a pediatrician before I came here. And what do you do with all those ear infections? Amoxicillin, you go through 4 sets of antibiotics and then tubes. I had thousands, I'm sure thousands of babies that I put on antibiotics. And I never read the study on amoxicillin that actually said that the kids put on amoxicillin for ear infections have more ear infections than the kids that don't. But I did read it when I was in this place. I read the study. I keep trying to find it. I haven't looked for it that hard, but I can't find it. But the first pediatric patient that I saw when I came here, and you have to recognize that this is a whole new field for a left-brained physician to come into alternative medicine who spent 20 years in standard medicine. And I had a mother come in with a 6-week-old or a 2-month-old with an ear infection who had been on antibiotics from 2 weeks of age for 6 weeks. And this was and I had done this for 9 years, but I knew I couldn't do what I'd been doing as a pediatrician for 9 years. It wasn't the philosophy. And it was the first time I looked at a mother, prayer, when you're in the foxhole, everyone has prayer, right? Well, I looked this mother in the eye and said, she was breastfeeding. I said, if you clean up your diet, you get on these supplements, your son's ear infections are going to go away. And I just prayed. Because that's nothing I'd ever told anybody for 20 years. And it scared me to death to think that something as simple as changing my diet would make that big of a difference in a child and what we're doing to children today. And she called 6 weeks later and said, my son has a stuffy nose and he can't breathe out of his nose. What can I do about it? I said, well, where's the ear infection? She said, oh, there's no ear infection. He's just fine. He just can't breathe out of his nose. What can I do about it? And I'm thinking, I spent 9 years with 4 sets of antibiotics and then tubes. And I don't know how many kids were put on 10, 15, 20 sets of antibiotics when I was a pediatrician. And now I see these mothers bring these kids, ear infection kids in, autistic kids in, all these kids in, and I'm treating them differently. And it's working without the use of drugs and surgery. And that is the premise upon which we operate, that there are safe ways to do this.